This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Peripheral vascular disease, if left unchecked, could lead to a whole host of complications, from difficulty walking to the loss of limbs. Mercy Health's Heart and Vascular Unit helps diagnose and treat peripheral vascular disease. Dr. Adam Raskin shows us more.
My name is Dr. Adam Raskin. I'm an interventional cardiologist here at the Mercy Heart and Vascular Institute. I am the medical director of the cardiac ICU and the co-director of the PE response team here at Mercy. So what is peripheral vascular disease? Peripheral vascular disease basically encompasses all blockages in any blood vessel outside the heart, whether that is the neck vessels, the arm vessels, or the major tube that comes out of the heart that goes to the legs. There are several complications from peripheral vascular disease. The most dreaded complication is limb loss. It can be something as simple as claudication, which means when you walk around your legs hurt, which would be non-life or limb threatening. But unfortunately, the most common thing is, which I tell patients all the time, is life happens and you might step on a nail, you might get your toes clipped, and unfortunately that can develop a wound from poor circulation or peripheral vascular disease. And unfortunately, as a consequence of that, can develop in a limb-threatening situation. So someone who would be considered high risk would be a smoker, a diabetic, someone who's got uncontrolled cholesterol, or if someone has other types of atherosclerotic disease. And what does that mean? Someone who already has heart disease, someone who already has carotid disease. For example, if they've already had a myocardial infarction, or they've already had a stroke, that puts you at high risk for peripheral vascular disease. There are multiple ways to make the diagnosis. Obviously the clinical suspicion ahead of time, the symptoms that go along with it, but then there's imaging modalities that can make the diagnosis. There's images that are taken both invasively and non-invasively. When we say non-invasively, something as simple as an ultrasound can make the diagnosis. And then when we say invasively, there are procedures that in the end might be needed to not only make the diagnosis, but then also treat it. Multiple different treatment options for peripheral vascular disease. I think the core of what we do is medications. I say this all the time, that we're thinking of pipes. You treat a pipe with Drano, right? You pour medicine down, that is our Drano. There are medications that'll reduce the degree of blockages. There are medications that will increase the speed of flow and as a result reduce the symptoms and prevent something dreaded from happening. We strongly encourage a walking or exercise program. Regular exercise to me is crucial for any form of vascular disease. And then if need be, again, just like a plumber would go in with a snake and clean it out, same idea. We can go in with balloons and wires to clean out of blockages. And then also sometimes there's a surgical option as well to treat this. Based on the severity will give us a good idea of the prognosis. Someone who is a claudicant, meaning pain with simply walking, will have an excellent prognosis. They will do great over many, many years with good treatment. The dreaded complication, again, is a wound or infection, can be life-threatening. I tell every patient that there is nothing better for someone with vascular disease than to move around. Be active, be active, be active, and then be more active. It'll help not only your legs, but also your heart. Our expectation is for someone to be better than when they were before they came into the hospital. So the expectation is never to go home and sit in bed. The expectation is to go home and walk, and then run into our office. We do a screening program in our office. Whether or not you're there for chest discomfort, lightheadedness, high blood pressure, you will be screened for peripheral vascular disease. Again, to identify it before you have symptoms. That is our goal as a system. If you are either concerned that you have peripheral vascular disease or at risk for peripheral vascular disease, the best thing to do is to be seen at one of our offices. We do a great screening program. The easiest way to do that is to go to mercy.com, find an office nearest you, and make a phone call. We'd love to see you.